Conventional approaches to migraines are haphazard and a guessing game at best, which is heartbreaking because we know so much more about the biochemistry of migraines than is being utilized in clinical practice today. The problem is that it takes a little investigating to figure out what's going on with a particular individual, and conventional medicine just doesn't look at the patient as a whole person to be able to do this effectively. And so then they miss a lot of clues that they need to understand what's happening in a particular person. So in this episode of the Whole Body Migraine Assessment, I review the information that's shared by the person who signed up for this call and evaluate their symptoms to give them an idea of some of the patterns that are emerging, some of the red flags that I'm seeing happen. And that can guide us towards those underlying biochemical imbalances that are contributing to their migraines, which will give them direction in understanding where they need to focus their care so that they can actually begin healing. So my name is Dr. Tanya Paynter. I am a naturopathic doctor who specializes in helping women with chronic migraines more than 15 days a month who just doesn't find that medications are effective for them. And we do this with a very systematic approach, first of evaluating and understanding the symptom patterns that are emerging for a particular person, and then tailoring that treatment, that protocol, their plan to them specifically to help them heal. And it can be amazingly effective. We have a 92% success rate in reducing migraine frequency and intensity with our clients by the time they're done working with us. So it is possible. And again, these are women that are experiencing 20, 30 migraine days a month for 20 plus years. So, it doesn't matter how long it's been an issue. It doesn't matter what medications do or do not work for you. None of it matters. If we figure out what's going on for you as an individual, you can heal from them, right? Our migraines are just a symptom of our body being out of balance. And once we get that back in balance and we heal what needs to be healed, we start seeing that those migraines improve. So for today's whole body assessment, we have Marla. So I'm going to read you a little bit about what Marla shared with us. So Marla has been having migraines for 15 years. She only discovered a year ago that they were actually migraines. So she's been having a lot of neck and shoulder pain and headaches and things like that, but she was diagnosed a year ago. She says that on average, she gets about 12 migraines a month, but she's still learning what her symptoms are as relating to a migraine. Her migraines typically start upon waking, and usually starts as muscle pain for her and then will progress into the head pain. She has not noticed a hormonal component. She has not noticed any GI symptoms or foods that trigger her. Nothing that she's tried has helped thus far, except that now that she knows that she has migraine, she was prescribed sumatriptan, which works well, but she has side effects from it. So obviously would prefer not to use that. Family history of migraines without pain, just aura, and mom had a lot of headaches. They thought it was tension headaches. So who knows, maybe she had some migraine aspects as well. That's kind of recapping most of what she has shared, except for the fact that she states that she has a lot of muscle pain, especially in her neck and shoulders on the left side. That's where mine is. And if left untreated, then we'll get a stabbing pain in the occipital area. So lots of really great information here. We just have to put it together. So there's a few things, Marla, that we want to take a look at. Number one of the things that studies have shown over the last couple of years is correlated with migraine intensity and frequency is our mitochondria function. And so anytime I hear, especially if exercise triggers you, which it doesn't look like you say that it does, it doesn't look like heat or exercise triggers your migraine. But generally speaking, because there was such a high correlation in people with chronic migraine and mitochondrial dysfunction, and if you don't remember the mitochondria, it's the powerhouse of the cell. So it's what provides our cells energy. And our brain uses up a ton of energy. So if our mitochondria isn't putting out enough energy, that can actually trigger the cascade that will lead to hyperactivity and pain. And so when we're looking at just generally speaking, some supportive things to do for yourself, doing some things to support mitochondria. So you can kind of Google those: fish oil, CoQ10, L-carnitine, some of the alpha lipoic acid, some of those things that can be helpful for that. And then also looking at your antioxidant status. So again, there was another study that showed that 87% of people with chronic migraine showed a deficiency in glutathione, which is our most potent antioxidant that helps us to detoxify from just life, exposures, chemicals, things like that. So Those are always two things that I always want to take a look at in all of our migraine patients, because so many people, 87% and 92% respectively, so many people have these underlying issues. It's not going to hurt to address them, and it can only be helpful. So those are just two basic things to take a look at. Specific to you, Marla, taking a look at your statement of waking with migraines, you typically will wake with them, or at least with muscle tension leading into it. So there's a few things to take a look at. One is there a potential for a medication withdrawal happening? So if you're taking medications, you're taking anti-inflammatories, you're taking, daily use of some sort of a migraine specific or headache treatment, that's, either an over-the-counter or a prescription, that can contribute to those early morning waking headaches. Essentially, you've withdrawn from the medication and now the symptoms are coming back. Don't know if that's the case or not, but it's one of the very first things to think about. Then we want to look at other stuff like, do you have sleep apnea? Have you been screened for that? If not, screening for sleep apnea is a very good idea. There is a high correlation between sleep apnea and waking with migraines specifically. And then we also want to take a look at two other things. So if it's none of the above, the other two things that are most commonly associated with with waking migraines is low serotonin and low cortisol. So the fact that your triptan works for you tells me that there is definitely a serotonin component going on, right? Triptans work on the serotonin pathway. And we also know that a lot of migraines are correlated with drops in serotonin. And so that's one of the reasons why triptans work so well, but they can have lots of side effects because having too much serotonin can also cause, its own set of problems. So serotonin drops serotonin is lowest at nighttime, but it's also present to help us sleep. So there can be a component of a low serotonin picture. It's lowest at about 5 a.m. And so again, if people are waking 4 or 5 a.m. and they've got a migraine started, that's a pretty good timing clue to look at that could be potentially related to serotonin. The other thing is looking at low cortisol. So you said that when you go to bed late and you get up early, that you oftentimes that will trigger a migraine for you. So when we're looking at, disrupted sleep patterns, that messes with our body's timing of release of cortisol. And so what we can see is that, periods of stress, acute stress, not getting enough sleep, being overtired, things like that will contribute to this cortisol piece. And I've gone into cortisol a lot. You've probably watched some of those videos. You've stated that you've watched several of my videos. So looking at some of those cortisol videos could be helpful in determining a little bit more about what might be going on from a cortisol standpoint. So again, to rule this in or out, from a symptom standpoint, we're looking at things like, does stress trigger you? Do you feel really exhausted all day long? Does it take you several hours to wake up? Do you notice that it seems worse around a certain point in your cycle? Does exercise trigger you? You did say that was a no, but do you feel really wiped out after exercising? Those kinds of things can point to a low cortisol picture. The best way to tell what's going on from a cortisol and hormone standpoint, as I've mentioned before in several of my other videos, is hormone and cortisol testing from a functional standpoint. So we're not looking at saliva. We're not looking at blood. We're looking at saliva or urine testing. So those would be some pieces that kind of clue into to that morning waking. And then, of course, there's some other stuff, taking a look at blood sugar balance, taking a look at, is it a pillow or is it a neck, a bed issue, right? If your body's out of alignment, those can also be compounded in the morning too, but it tends to be more kind of neurochemical that we see more than structural. So then we want to take a look at tracking your cycle and the hormone relationship. So you did say that you have not noticed if there's a hormonal component. In my experience, I have yet to meet somebody who has not had some level of hormone imbalance, whether that is frankly off, like they frankly have low progesterone or low estrogen or both, or that their estrogen progesterone ratio is where it should be. So that's very, very rare to find that those are right on. So we tend to see that there is a hormonal component. You just might not notice a cyclical nature. So it might not manifest maybe your bathtub, if you will, of inflammation will get to a certain point, and you've got some leeway in there with your hormones, but then other things will push you over more. So it might be more of a contributing factor than necessarily a trigger for you, but it's always something to be good to look at and screen and completely rule out from a functional standpoint, which again is that urine and hormone urine and or saliva testing. And then we also want to take a look at what the vasoconstriction piece is going on. So again, triptans work on that serotonin pathway, but it also helps with vasoconstriction. So if you notice that caffeine helps, if you take a medication that has caffeine in it, like the Excedrin migraine, or something like that, that also can help take the edge off. Or if you notice that caffeine triggers you, or some of those things, then the vasoconstriction piece can be a big deal. And so taking a look at how that might be affecting you. And I've talked before in some other videos about arginine. Arginine is an amino acid that contributes to the production of nitric oxide. Nitric oxide causes vasodilation. And so in some people who have, some wonky vasoconstriction, vasodilation triggers happening, a lot of times it can be from the arginine piece, that they're just eating foods higher in arginine. They're not even aware of it because it's not a food per se, but it's the amount of arginine they're eating through the day that can be problematic. So I don't know for sure that this is something that I see as a huge red flag for you. But anytime someone says the triptans work really well for them, the two biggies that I look at is, what is their serotonin level doing? And again, doing some neurotransmitter testing can be very helpful. That's a urine test. And then taking a look at, is vasoconstriction playing a role? What's your role and involvement with caffeine? Does that trigger or help your symptoms? If the answer is yes to either of those, then we might look a little bit closer about how the vasoconstriction, vasodilation piece might be going on. So the last piece that I want to mention for you very briefly is taking a look at body adjustment. So again, if we're looking at, or body alignment, I should say, if we're looking at, waking with things, you have a lot of muscle tension, especially one side, that tells me there's likely a component going on. I don't know if you've done any body work, massage, physical therapy, chiropractic, acupuncture. Those can be wonderful to look at. One thing that I do know is in about 50% of cases, we see eye misalignment being a big trigger for people. So I don't know that that's a red flag again for you specifically, but I thought I'd mention it. Is depending on, does computer time trigger you sitting at a desk? Is that, in front of a computer, is that a major problem for you? And again, it can be posture related, but it can also be eye misalignment related. So if our eyes are focusing naturally behind the computer screen or in front of the computer screen, it takes our muscles intense work to try to bring the eyes into focus. So focusing. So again, if our natural alignment is behind the computer, it takes a lot of work for our little eye muscles to pull that so that we're focusing on the computer itself. And again, this is found in about 50% of people with chronic migraines that are triggered by screen time. And so that's a pretty large percentage. And there's a fairly easy, you can go to a doctor, an ophthalmologist or optometrist who can test for eye misalignment. So you would actually have to Google NeuroLens. NeuroLens is a company that provides prism glasses for people. They have a little questionnaire on their website. And then they will, if you come back as this is a potential problem for you, they will direct you to somebody in your area who has the capability of testing for eye misalignment. And I think that's a wonderful thing that is often overlooked, is how that could be playing a role with the little mini, stresses of having to have those muscles tense all day long. By the end of the day, you're going to have a headache as a result. Now, again, yours seem to be more in the morning, not quite as big of a red flag, but it's a free online test. It's like 5 questions. You can screen yourself to see if that's something you should even look at. And if so, then you might consider doing, just having some regular testing done at an ophthalmologist who has the capability of doing that. So So hopefully that was helpful, Marla, and to anybody else who might be watching, how we can look at some of these patterns and the symptoms that are expressed during migraine for a particular person, and understanding a little bit more about their body. Again, the more we go into health history and known triggers and things that are being observed about the migraines, the more information we can get, and then we can understand even more about the role and relationship of genetics that might be at play, some of the neural pathways that can be at play. And once we start focusing in on those major problem areas with some additional testing and some nutrient testing, dietary exploration, and hormone and neurotransmitters, we have everything we need right there. And then it's just a matter of putting all the pieces together and understanding how your body is working specifically. So for anybody else who is interested in doing a whole body assessment, you can sign up in the link below. And if you want to learn a little bit more about our process and some of the things that we have available for you, including free resources, you can go to our website at migrainemastery.org and check some of those out.